Consultations for Health, helping you progress in communication skills to optimise the care of your patients. In this video, we will explain one of the most common communication traps that many people fall into during their questioning, which is using compound and leading questions.
This video is part 2 of compounding and leading questions. This video will discuss what leading questions are and how to spot them using an example scenario later on. If you missed the first part of this video talking about compounding questions, we recommend that you check it out afterwards. Now, back to the video.
In comparison, a leading question can be described as a question which implies there is an expected response to be given. It's not unusual for a patient to agree, even if it's not true, because they feel they need to give you the right answer in order to get the care they want or need. For example, a leading question may sound like, "Are you feeling a little better since starting the antibiotics?" This is a leading question because it's preparing the response to be positive about the antibiotics and implying that the patient must be feeling better because of them, when in fact the patient may be feeling worse off or no different since starting the antibiotic. The use of leading questions will again result in short and inaccurate answers, preventing the full picture from being understood. For example, "Is it hot when I touch your chest?" may sound normal. However, it is leading because it's suggesting to the patient that their chest should feel hot. A better way to ask the question could be, "How does your chest feel when you touch it?" Now we've talked about the similarities and differences of a compound and leading question. To test yourself and to see if you've learned the difference, let's look at some scenarios where both compounding and leading questions are used during the information gathering stage of a consultation.
But we're not quite there yet, which is why we'd just like maybe another couple of weeks if you'd be happy to do that for me. I think that would sort everything really.
And is the surgery site tender? I imagine that's tender to touch.
It's not too bad. I mean, I have had a couple of problems putting a coat on and things, but again, it's after surgery, so I just kind of expect that, wouldn't you, really? So, but it has improved with the antibiotics. I think that's why I just would like another week or so, and
Right.
That might help things. Yeah.
And is it red?
It is a bit red, but there's a scar. I've had the what's it called, the dressing routine.
change, yeah.
It's not bumpy or anything, but it's just a bit red, but kind of like pale skin, not nasty looking red, I'd say.
And are you in a lot of pain after the surgery?
I mean, my friends had to get me a booster seat for the toilet because it can be painful to sit down, but it's nothing I can't manage, and this is why I just think another week or two of antibiotics will clear up the whole thing and then get rid of the booster seat. And yeah.
So you mentioned you're not in a lot of pain, but you've got the booster seat. So what what is the booster seat for then if it's not painful?
Well, it's like, I'm sure if you've done a workout class and your legs get really tired and your tummy, when you go to sit on the toilet, it's just really it's that really niggly kind of pain. But I've had it before. The booster stopped that, so we don't have to worry about that.
And is there anything else that you're doing that causes pain? So like imagine if you're getting dressed, is that painful to do?
Well, the jacket, it does. When you when you stretch it, it is it's a bit. But that's again the antibiotics. I think we're just nearly there, but not quite.
Right. Okay. So you kind of suggesting that you think that actually you're quite well, but the little bit of pain, but not a lot. So I'm not sure why do you think you need the antibiotics then? Why do you think you need a longer course of antibiotics?
When you feel you're getting better, but you're not quite there.
Right.
And yeah, there is this.
Critiquing a consultation can be difficult at first, but being able to spot these common mishaps, you can make changes to your own practice and try to change the way you gather information. We hope you've enjoyed this video, and we want to thank you for your continued support. We've recently passed 2,000 subscribers, and we're excited to make more videos to support your consultation skills development. Make sure you like, comment and subscribe to see our future videos. Don't forget to turn on notifications to be notified of our latest uploads. Thank you again from everyone here at Consultations for Health. And remember, keep practicing.